there's really not an against gravity or gravity eliminated for this one. Okay, so what I'm going to do is I'm going to stabilize her hand. I'm testing the adduction of the thumb toward the palm. So when we did range of motion, we had them slide all the way across. We're not going to do that for this. We're just going to ask her to bring her thumb to the side of her hand and hold it there. Okay, if I do resistance like they show here, it's going to be like this. I'm going to, relax for me a second. I'm going to put my fingers here. I'm going to ask her to do the action. Hug your thumb to your hand and don't let me pull it out. And I'm going to give her resistance out with 2 thumbs. And all I'm trying to do is pull her straight out to the side. Remember, abduction is just like this. When we measured it with range of motion, it's straight out to the side. So against gravity, it's like that, or I can do it like this. I can also just have her do it this way and put 2 fingers and pull straight up. So you can do it like this. If you don't want your fingers pinched, do it this way, okay, where you just pull straight up. All right, so that another test, like it says here, that's frequently used, and sometimes you see a neurologist or the doctors do this, is make a fist like this for me, Kelly, and then put your thumb there. Now I'm going to put a piece of paper under there and have her do that, and I'm going to try to pull the paper out. If it holds, then that's just a test for the adductor, it's working. If it slides out, if I ask her to do that and it slides out, then she's weak. But that doesn't, you can't really grade that. So that's what's talking about here. And you'll see doctors do that kind of a quickie test, but we'll usually do a little more involved in that. So abductor, if you look at your abductor, it's a straight pull, okay? Kind of angles here toward the base of the, scaphoid a little bit. And same thing, I can have her hand on the table. I can stabilize her underneath like this if I want. Remember, abduction is just a straight up action, so against gravity, it's going to be just like a hitchhiker thumb. My resistance is going to be on the proximal phalanx, okay, so that's here. I'm going to use 1 finger, and I'm going to ask her to hold that position, and I'm going to push down. And I'm just trying to push her straight back down toward adduction, to that position there. So now this time break, don't hold it. So if she broke, it would look like that. Okay, but now hold. I'm going to give min, mod, max, and she does good. Okay? Now if you look at opponents, if you look at them side by side, they look very similar. But look at your muscle. The opponents has, let me just say, okay, gravity eliminated would be like this. Okay, same plane with the table, and I would just ask her to pull her thumb out. If I think that's full range of motion, I'm going to give her pour. But if I'm not sure, I can always look at her other hand. Let's say, pull that one further. So let's say that one goes all the way there, and this one only goes about right here. Okay, I'm going to determine that that's incomplete range of motion and give her a pour minus. Okay, so you can use their other hand sometime. All right, so that's the gravity eliminated. Okay, for opponents, we're going to put them in supination for against gravity. Remember when we did range of motion, we asked them to point their thumb up to the ceiling, and we measured. So it's the same thing, the same position. But what we're looking at is she goes from here to here. There's a rotation component. And if you look at the opponents, it's got an oblique pull. So it's not straight up and down like the abductor. Okay, so I'm going to ask her to do that motion. My resistance is going to be a rotation movement. Okay, I'm going to try to pull her down and around like that. So this time don't give me any resistance. So when I pull her, it looks like that. Okay, so now she's back up there. The thumb is just kind of there for stabilization. I'm not really doing anything with it. Okay, now I'm going to give her resistance, and I'm going to try to pull her down and out. Okay, so I'm trying to create that rotation movement. If I just push her straight down, I'm testing what? Abductor. Okay, this one. So it has to have the rotation component, or you're not testing opponents. All right, these two are innervated by the same muscle, by the same nerve. So if we saw weakness in one, we might expect to see weakness in the other one. Okay. Adductor, we didn't talk about this, but when you're testing adductor, sometimes you'll see thenar wasting in here. That's usually the adductor. If it has atrophy, that's where you see a hollowing here in the thumb. It's usually the adductor that you're seeing that. That's that big fan-shaped muscle, and it gets atrophied. They have a hollowing here. Okay. Okay, so practice those 3 just like this. Don't let